Central Maine Healthcare has been serving the Mid-Coast community for more than a decade. First at Topsham Family Medicine, where over 7,000 patients see our team for primary care, and more recently at the Topsham Care Center and Maine Urgent Care. But patients and providers needed access to the next level of care, access to outpatient surgery and needed procedures close to home and at lower costs than high-priced hospital settings. Healthcare bills top most Americans' list of worries, and in Maine, with our significant elderly population, one barrier to getting good care is reliable transportation for seniors to get to that care. Nobody should have to drive long distances or face big hospital bills for procedures like colonoscopies or same-day surgeries that can be safely accomplished on an outpatient basis. Central Maine Healthcare has a solution, an ambulatory surgical center conveniently located at the Topsham Fair Mall, close to where thousands of Mid-Coast residents live, work, and play. Nationally, the cost of outpatient procedures at an ASC is around half of the typical hospital bill for the same procedure. Dr. Dave Salco has been seeing patients at Topsham Family Medicine for over 11 years.
Ambulatory care centers, the way that they're organized, just like the Topsham Care Center, they provide services that are at a lower cost to patients, a more cost-effective structure. Quest is a lab services over there. The urgent care is definitely lower cost than an emergency room. So these are strategies that not just brought on by providers or patients, but also payers. So insurance companies look at this and they know what they have to spend. Employers know what they have to spend in healthcare. There's a huge need in this area to have an option like this. If it can be done safely, efficiently, effectively at an ambulatory surgical center, then I think we should start to move in that direction. This is just a new innovation in how to provide medicine, how to spread out care for patients, and how to get people access to what they need.
Ambulatory surgery centers, or ASCs, are becoming increasingly common across the country. They are becoming so popular and offer such quality care at a lower cost that even Medicare treats them favorably. But in Maine, we only have 16 of these freestanding outpatient centers, and there are none in the Mid-Coast. Central Maine Healthcare would become the first health system in Maine to offer this type of service. Therese White is a talented plastic surgeon who sees patients across Maine.
We at Plastic in Hand have a greater than 30-year experience with ASCs. Ours was the first in the state, and so we are very familiar with the model. We're also very familiar that if structured appropriately, which is the plan for Topsham as well, is that it's much more cost-effective for patients, it's much more convenient for patients, and for patients that are eligible for outpatient surgery, it's in fact less risky, the infection rates are better, and the care is, to be honest, much more personal.
The benefits of an ASC at Topsham don't stop with satisfied patients and doctors, though. This $14 million investment in the community will make the Mid-Coast even more of an attractive location for businesses and homeowners. Attracting successful businesses to Maine and the workers who make them successful requires well-located, affordable health care. Some facts and figures about this project. The cost will be $14 million. The location will be Topsham Fair Mall, right next to the existing Topsham Care Center and Maine Urgent Care. The project is being reviewed by the state of Maine. Upon approval, construction would start early in 2021, and patients could start being seen the following year. 2 surgical suites, 4 procedure rooms, and comfortable patient areas and waiting rooms will be built. The ASC will employ 16 people, not counting the board-certified Central Maine Healthcare doctors and others who will see patients there. In the end, we are responding to a need in this beautiful area of Maine, where we have served the community for many years. Patients, families, doctors, and community leaders have asked for the next level of care. We're proud to be answering that call.